You have seen it. Celebrities dropping their weight. It's not just magic. It's not just willpower. It's something called as Mounjaro. As a dermatologist, I've been constantly asked this question. How does it work? What are the side effects? What does it do to my body? When can I take it and how can I take it? So today, I'm going to decode each and every question and smaller points for you to understand about this magic drug called as Mounjaro. Hello, I'm Dr. Deepam Shah, founder medical director of Viva Aesthetic Clinic. Let us start with the point that what is Mounjaro? Mounjaro is a GLP-1 analog and it is named as tirzepatide. So how does it work in your body? So when you inject this in your body or when you take this, it goes and tells your satiety center, which is in the brain, or the hunger center in the brain, that I am already full. So it makes you something like I am already full. So you will start eating lesser amount of or lesser quantities of food. And because of that, you will feel more stomach is fuller and your intake of calories will keep on decreasing. So this is the mechanism of action. By making you fuller, it decreases your weight. That is how the action is started. So you have to understand that weight loss is not one part of the treatment. We have to deal in the holistic way. So we at Viva Aesthetic Clinic are dealing in this holistic approach, which not only targets your weight, but we want to reverse your diabetic status. We want to decrease your blood pressure. We want to reverse your cholesterol. We want to reverse the arthritis which can happen because of weight. So in our clinic, we have a complete 360 approach where we have a nutritionist on board giving a diet plan. We have a dermatologist for me on board which takes care of your medical management. We have an assistant doctor who will take care of your weights. They will be in your journey, will available on WhatsApp and support you in each and every step in the journey of losing your weight and simultaneously reversing all the effects which are associated with weight. So Mounjaro is basically injected subcutaneously in either 2-3 sites. One is your stomach, upper thighs, or sometimes in your deltoid region as well. It is a plan of generally 3 to 4 months, and what you see is that every weekly you start losing weight. So in the first week, you will notice anywhere 2 to 3 kilos, and depending on your individual weight at the start of the treatment, you can lose anywhere between 10 to 20 kilos of weight in 4 months. And it is not a replacement for hard work. So along with this, your lifestyle, be mindful of your eating, exercising regularly will complement this and give you better and faster results. So when a patient comes to me, we generally inject them in the stomach area. So we clean the area first, take the injection, give it subcutaneously at a 45 degrees angle, and then we make the patient lie for 2 to 3 minutes and then patient can go. So in fact, it is just a 5 to 10 minutes treatment and you can go back to your work immediately. Before the treatments, we generally, as a routine protocol, in a medical way, we take the pulse and blood pressure of the patient. So we just see that there is no side effects along with giving the injections. So this is about the injection part. Let us understand how and what it does to your body and what side effects you can notice. So the definite side effects which you notice because of feeling full is that you start noticing initially that you have a little bloating sensation, nausea and vomiting is very common initially, and even diarrhea. But these side effects are gradual and they eventually over a period of 1 to 2 weeks diminish and become negligible. Now also want to throw light on some of the recent claims which have been coming about the safety profile and the side effect profile of it. So Mounjaro is a very thoroughly tested, PubMed researched and published molecule. There was a trial of close to 8,000 people which was done in USA, and these were the only side effect reported: nausea, vomiting, diarrhea and bloating sensation. So don't just rely on some Instagram reels or some posts which are telling you about the claim of massive side effects of it. Definitely this is well researched. In the 8,000 people, no such side effects were reported, but always take this under a doctor's or a medical professional's guidance so that these risks, if at all it happens, is minimized or can be negated. So I often get asked, who is the right candidate for Mounjaro? So for me, an individual who has a BMI of greater than 25, a person who is in a pre-diabetic state, a person who is uncontrolled hypertensive, a female who is overweight and trying to conceive, a person who is having constant knee pain and it's because of obesity, a person having central obesity, or we can say the abdomen girth is very high. So these all are definite indications for giving Mounjaro. Now you have to understand your health is wealth. If your weight is not lost, you are more prone to even cardiovascular side effects. All these problems can lead to increase in cardiovascular events like myocardial infarction or heart attacks. So please be mindful of your weight, and it's a health revolution which we are living in. We have to be fit and perfect so that we don't go through these side effects.